Hello everyone, my name is Osama and today I will be discussing the posterior abdominal wall, specifically its muscles and the abdominal portion of the aorta and the inferior vena cava. So let's start with the muscles. So this muscle right here is called the quadratus lumborum. Its origin is in the iliac crest and it inserts at the 12th rib. It's innervated by the ventral rami of this L1 to L4 spinal nerves, and its main action, is the lateral flexion of the lumbar spine. Now, an easy way to identify it is that it has four sides. That's why it's called quadratus, four. And since its action is the lateral flexion of the lumbar spine, the name lumborum kind of makes sense. So, and for the second muscle, the psoas major, it's a very important muscle for a block. So its origin is the transverse processes of the L1 to L4 vertebra, and it inserts at the lesser trochanter of the femur. Now, a very important note about this muscle is that its tendon fuses with the iliacus muscle, and then they both travel to the lesser trochanter of the femur where the psoas major muscle attaches. It's innervated by branches from L2 to L4 ventral rami and direct branches from the femoral nerve. And its main action is hip flexion and the same as quadratus lumborum, lateral flexion of the lumbar spine. Now for our third muscle, iliacus muscle, its origin is the upper part of the iliac fossa of the ilium ilium bone, sorry. It inserts at the lesser trochanter of the femur, like we said. It fuses with the tendon of psoas major and they both travel and attach at the lesser trochanter of the femur. It's innervated by the femoral nerve and its main action is hip flexion. And the diaphragm, of course, you might remember the diaphragm from the CV block, so I didn't include that many details about it. But just to remember, it's innervated by the phrenic nerve and it basically divides the thorax from the abdomen. And in this picture, you can see that it's retracted up using these retractors. So the diaphragm has three main openings. The cable opening T8, where the inferior vena cava passes through, esophageal hiatus at level T10, where the esophagus passes through, and the aortic hiatus at level T12, where the aorta passes through from the thorax to the abdomen. Now the abdominal aorta has three main types of branches. It has unpaired visceral branches, paired visceral branches, and parietal branches. Unpaired visceral branches basically has one artery, like it's not a pair, it's just one artery that supplies supplies specifically the GI organs. Celiac trunk, it arises at level T12. Superior mesenteric artery arises at level L1, and inferior mesenteric arteries branches at level L3. Now for paired visceral branches, there's a pair, so there's basically a right and left artery, and it's mainly supplying the urogenital system. So the renal arteries, there's two right and left renal arteries, and they both branch at level T2. Medial suprarenal arteries, there's right and left medial suprarenal arteries, and the gonadal arteries, which can be testicular or ovarian depending on the gender of the patient. And parietal branches, they supply the abdominal wall. They don't supply organs anymore. There are still organs, but they basically supply the muscles of the abdominal wall. So the inferior phrenic arteries, there's right and left inferior phrenic artery. Lumbar arteries, there's four pairs, so there's actually four right and left lumbar arteries. And the median sacral artery. The medial sacral artery is actually it's unpaired, so it's only one artery. And at level L4, the abdominal aorta bifurcates into the left common iliac artery and right common iliac artery. So the right renal artery is now to remember that the abdominal aorta kind of runs at the midline, but it's a bit shifted to the left. So this makes the right renal artery a bit longer, and it passes posterior to the inferior vena cava. Okay, Now the gonadal arteries, they arise just inferior to the, if you can notice that here the renal arteries kind of branch from the aorta, and the gonadal arteries, they branch just inferior to the renal arteries, and they descend on the anterior surface of the psoas major muscle. Okay, both vessels, I think, the arteries and the veins. I'm sure about the arteries, but I'm not sure about the veins. They both pass on the anterior surface of the psoas major muscle. Now the common iliac arteries, they both they bifurcate into external, both of them, right and left. They bifurcate into external and internal iliac arteries. The internal iliac arteries, they supply the organs of the pelvic region, but the external iliac artery, it gives rise to the inferior epigastric artery and deep circumflex artery, and after that it continues as the femoral artery, and it supplies the lower limbs. Now, this is a pathology called abdominal aortic aneurysm. It's when the abdominal aorta dilates just above the bifurcation, and the third part of the duodenum passes right through that. So when the aneurysm is large enough, it can cause a GI obstruction. Sometimes if the aneurysm is large enough, you can feel pulsations on the midline, kind of shifted to the left, since the aorta is kind of to the left, in the umbilicus area. And if it ruptures, it has a mortality rate of about 90%. But if it's detected early before rupturing, we can repair that by surgery, by placing a prosthetic graft, which is basically just a replacement of, we don't replace it, we kind of just put something that allows the blood to pass through, bypassing the dilatation. So let's talk about the abdominal portion of the inferior vena cava. Now the inferior vena cava forms by the union of these two veins, the common iliac veins, right and left common iliac veins, at level L5, and it travels up and passes through the opening of the diaphragm at level T8, the cable opening. Now, I'm sorry, it's anterior to the inferior vena cava lies the liver, portal vein, head of the pancreas, and the bile duct. The horizontal part of the duodenum, the right gonal artery, and the superior mesenteric artery. This should be anterior, not superior. And it does not directly drain the GI organs. The GI organs, they drain into the hepatic circulation, and then through the portal vein, the hepatic portal circulation, and through the portal vein, it drains into the inferior vena cava. So it does not directly drain these organs. So these are the paired tributaries of the inferior vena cava. Now, these numbers are just labeling the picture, but the tributaries are 2 to 8. I mean 2 to 7. 8 is kind of the veins that form the inferior vena cava. So the hepatic veins, these are the hepatic veins, and these are the renal veins, right and left. And 4 is the right suprarenal vein, 5 is the right gonadal vein, 6 are the inferior phrenic veins, and the lumbar veins, the multiple pairs of lumbar veins, and these are the common iliac veins that form the inferior vena cava. Now, special notes about the inferior vena cava: the right renal vein is shorter than the left renal vein. Like we said, the aorta is a bit on the left, the inferior vena cava is a bit deviated to the right. So it makes sense that the left renal vein is longer and the right renal vein is shorter. In the left renal vein, it passes anterior to the aorta, so right in front of it, if you can see. And the left suprarenal vein and the left gonadal vein, they drain into the left renal vein. They don't directly drain into the inferior vena cava. So that's an exception too. If you can see here, number 3 is the left suprarenal vein. It drains into the left renal vein. And the left gonadal vein, which can be testicular or ovarian, it drains into the left renal vein. And this allows us to understand this clinical scenario. We have something called a pampiniform plexus in the testicles and the ovaries. It's basically just a bundle of veins. So for any reason, the left renal vein is obstructed, blood will back up into the left gonadal artery, in this case left testicular artery, and into the pampiniform plexus. And in the pampiniform plexus, blood will back up and it will accumulate, which you can see when you palpate the testes, in the left testes specifically. You can see you can feel a bundle of worms when you touch it. So this allows us to understand this placement right here. And thank you everyone. Thank you for watching. Good luck with your studies.